All right, so I'm going to review the patient's chart. I'm going to review the physician's orders. The physician is requesting for the patient to be on 8 liters of oxygen with a hard bubbler. I'm going to gather my equipment. I have the hard bubbler here and the high flow nasal cannula. I'm going to check for precautions, make sure that the patient's not on any kind of isolation. I'm going to knock on the door, wash my hands. Hello, I'm Camilla Respiratory. Is it okay if I get some vitals on you? The patient said yes. Could you please tell me your name and date of birth? Look at the wristband. The doctor wanted me to put you on 8 liters of high flow nasal cannula today, okay? And the patient says, okay. So what we want to do, hard bubbler. I'm gonna hook it up to the flow meter. Okay, and I'm gonna hook the tubing up to the bubbler. I'm gonna make sure before I put the bubbler on the flow meter that I fill it up with sterile water. I'm gonna turn it up to 8 liters. Make sure that the prongs are down. I'm gonna stick this in your nose and put the tubing behind your ears. I'm gonna loosen it up a little bit so it's not trying to choke you out. Okay, how are you feeling? Does that feel okay? The patient says yes. And so I'm going to, check for the tubing, make sure that everything is like going all right, make sure there's nothing blocking it. Make sure that the fluid, make sure I monitor the fluids, make sure it's all right. I'm gonna record humidification use, and I'm gonna report any changes or additions of the humidification therapy to the doctor. I'm gonna report any abnormal findings to the doctor, and I'm gonna gather all my equipment. I'm going to wash my hands, and then I am going to chart.